A freestanding birth center is an outpatient healthcare facility that is designed to follow the midwifery model.
A freestanding birth center is a place that really facilitates and promotes physiologic normal birth. It's a setting that is specifically different than a home birth, but provides the same feeling or experience of care, and it's very different than a hospital birth.
Birth centers are an important piece of what I think about as sort of the full spectrum of maternity services of care for pregnant and postpartum people.
Currently, Vermont is one of only 8 states in the entire country with 0 freestanding birth centers. All of the states surrounding Vermont have freestanding birth centers.
At the federal level, if you look at the recently released White House blueprint, they very clearly call out the importance and role of birth centers and midwifery-led care as being important to address these issues of severe maternal morbidity and mortality.
I think that growing up, most of us in the United States think that babies are born in hospitals. That's just normalized. And most of us don't know that there's any other way. And it takes, education and exposure to learn.
I was looking for an out-of-hospital birth. To me, going to a hospital, you usually go there when you're sick. And so I was looking for a different kind of experience. I think I was very fortunate with the kind of care that I received. We had many appointments prenatal that lasted at least an hour each, which I know is not common in the hospital setting. It was really nice to have such a close relationship with the entire care team at the birth center.
I felt totally safe and totally prepared, that I knew that I had signed up to try to have a completely unmedicated vaginal birth. I really wanted to give birth in a tub with my husband, and that wasn't going to be an option at a hospital. I wasn't hooked up to IVs and monitors. I was able to freely move around the room and listen to my body, and so it was everything I hoped for.
All of the evidence-based practices that are really important to a foundation of a good start for both mom and baby, like immediate skin to skin, delayed cord clamping, no separation of mom and baby, helping facilitate breast or chest feeding immediately. That all happens without asking.
Baby basically never left my arms. They did all the tests right there.
Once everyone knows that things are fine and that you and baby are safe, you go home. And so that means a lot of your postpartum recovery and care is done in your own home. I had, the midwife that helped me birth my child come to my house 24 hours later.
A birth center impacts outcomes by reducing C-section rates, reducing preterm labor and birth, reducing low-weight babies. That comes from the very dedicated midwifery model care that is provided.
Not having a birth center, I think, fails to recognize and support those issues of choice and autonomy in a community. I think not having a birth center to some extent funnels people into a little bit of a one-size-fits-all model of care.
Vermonters are missing the opportunity to see birth as a empowering experience and really transform the way that maternity care is provided.